Hello to my lovely Facebook moms. I am Alison. I am a personal trainer, a mom of three, and a pelvic health coach for those that are new in the group. And today I have the pleasure of interviewing massage therapist. It's actually my massage therapist, so she's so awesome. So I keep going back to get my massage. Her name's Michelle Smith. And so say hello, Michelle, and introduce yourself to everybody.
Hi. Thank you so much, Alison, for having me on. So, yes, I am Alison's massage therapist. She let that cat out of the bag. And I've been a massage therapist for almost 20 years and an educator in the field of massage therapy. I'm also a doula. So, my focus in terms of my massage therapy practice is very much perinatal. So I work with moms and babies pretty much 95% of my practice. I'm also a mom of three girls, and my practice really took that focus when I was massaging while pregnant and realizing how beneficial it was for me to receive massage therapy, and how much I really needed more space and more support during my pregnancies. So it kind of took me down this amazing road of focusing my practice and building my basically my niche business around moms and providing support.
So you do postnatal as well as prenatal as well, correct?
I do. I take women through the entire journey. Sometimes I'm actually working with them when they're in the preconception phase,
Okay.
sometimes with fertility struggles and or just planning for babies and then right into pregnancy.
Mhm.
Sometimes I'm supporting them during birth, so during birth and then definitely beyond in the postpartum phase.
That's amazing. I love the way that you've tied all your interests into like one sort of business, like the doula stuff you can do like
Hmm.
during someone's labor, you can be massaging and stuff. I think I love that way that you've tied in everything. It's beautiful and awesome.
Thank you.
So you said for yourself, what made you passionate about your field was your own sort of journey. So how did
Hmm.
massage benefit you during your pregnancies?
So, in my first pregnancy, which I like to call my princess pregnancy, things were very textbook.
Why
You
is it
know,
princess pregnancy? Is
princess pregnancy because you nap when you want to, you don't have any other children to take care of.
yes.
Everything's new. It's a first time for everything, the ultrasounds, the baby showers, the so I felt very much like a princess, and I felt like it was quite smooth. I was very fortunate. Baby was born healthy, no complications. I had massage during that pregnancy. It really was helping me to be able to work as long as I had wanted to. So I worked until 37 weeks,
Okay,
and then I
great.
delivered at 37 weeks. Anyway, in my second pregnancy, I found that massage therapy deepened in terms of the use, and I figured this out for myself, and this is what affected my practice even more. I had complications in my second pregnancy, where at 20 weeks, we discovered that our baby was going to have a chromosomal genetic abnormality or anomaly. And the stress that I was experiencing during that pregnancy, both physical, now taking care of a toddler, married, commuting, um, the emotional and psychological pressure
Yeah.
to still be able to perform in all levels. I was teaching, treating, and parenting. Um, it was a lot. And I found that actually going for massage in that instance was creating a lot more that I didn't even realize I could be creating for my patients around coping through pregnancy, having a safe space to talk, having a safe space to rest, and really prioritizing self care, which would become even more important as I then added a third baby to
Yeah.
my life. And so massage has become this teaching vehicle and also the vehicle that I use to teach mamas about how to take care of themselves through all stages of the perinatal cycle.
I relate to what you're saying about the stress because you obviously I talk to you, right? I
Mm-hmm.
enjoy that part of our sessions as well where we can connect because my third, as I mentioned, she also has exceptionalities. I don't really like the
Yes.
term disability per
Yeah.
se because she's fine. like
Yes.
she just has to do things a bit differently.
That's
Um,
right.
and for me, I didn't find out till after, so I didn't realize that that was going on. But it's so beneficial. So for those that know even within their pregnancy, right? Because obviously, like I've shared that that has been a stress for our
Mm-hmm.
family, all the therapies you have to go to for the child and stuff. So I found for myself, massage
Yeah.
therapy, so it is so beneficial for releasing of that stress. My
Mm-hmm.
body holds all that in as a mom, right? Like you're holding all
Yes.
that, and even if you have a great partner, primarily the mom is doing the therapies, the mom is booking the appointments,
That's
and
right.
that's unfortunately how it is.
Yes, or whoever the person is with that child full time. So, in
Yeah,
whatever your structure is, if it's mom, then it's mom. If
yeah.
it's, dad, it's dad. If it's someone else in the family, but whoever that primary care person is, they're the ones at the appointments. They're the ones juggling the schedules, and it is a lot.
I definitely know that from firsthand that it
Hmm.
is a lot.
And it
Uh,
tends to be a lot more in the first years of the child's development. So
which you
it,
remind me of. So I know I'm going to get to where you're at one day. So I
yes,
look
you
forward to
will.
getting there, right?
I tell
Getting all
you,
the
it's
milestones.
amazing. Now,
Mm-hmm.
my middle daughter is 14, and her checkups are basically her annual physical and
Mm-hmm.
blood work versus the first 2, 3 years, repeated specialists and checking up on things. And to be honest, like she's extremely healthy. So it
Mm-hmm.
wasn't even because they were showing signs of any difficulties, but just more preventative and monitoring,
Mm-hmm.
a lot of monitoring.
Yeah, I'm in the thick of it, so I can't even say like I'm looking forward to come out when it's a 1 year, once per year check.
Yeah,
100
1 year.
appointments a year suck.
It
I'm done with
does.
it.
It does. And it's not fun for them either, right?
No. I was gonna say for those moms that are coming and they're seeing a pelvic health, because you work out of a woman's pelvic health clinic. So women that are
Mm-hmm.
coming in for pelvic health and those sorts of things, they're having aches, they're having incontinence, or they have
Mm-hmm.
diastasis recti, any of those prolapse, any of those sort of complications that can happen either
Mm-hmm.
within pregnancy, right? Because you have sometimes
Yes,
pubis symphysis sort of conditions, or you have
that's
like
right.
what can happen after, etc. How is massage going to be beneficial for moms that are coming into the clinic for that want to add something else to their treatment plan?
Okay. So yes, working hand in hand with the pelvic physios has been it's been a dream for me actually, professionally, but also just in the results that I see in my clients. So there's all the benefits we just mentioned around the creating space, stress relief, managing all of that. That comes with any massage. Well, if you're a good massage therapist, that should come with any massage. But then when I focus more on the pelvic health side of things, what I do is match my work with the pelvic physio in that I do not work internally. It's out of my scope to work internally, but the muscles around the hips and glutes, the lower back, the inner thigh, the hip flexors, the abdominals, all of those tissues are also affected in terms of your pelvic health. There's usually tension, trigger points,
Mm-hmm.
fascial restrictions, adhesions, all these words that some of the mamas might be familiar with or maybe don't have the language for it, but they can feel it in their body. And the physios don't have time to actually work on all of those structures externally. So what they do is they'll, for example, if we use you as an example per se, if you came into the clinic and you were seeing myself and one of the physios,
Mm-hmm.
I would
Yeah, when
see
I
in their
came in, I was
charting.
seeing Laura, and then
That's
Laura told me
right.
about you.
Right. And so Laura was working on whatever she was working on. I'll leave it to you to say what it was or what it wasn't. And then she's able to guide by putting in her notes, like, the hip flexors need releasing, the gluteals need work, the adductor muscles need work. And then I'm able to do that work as a massage therapist, very focused, and it ties things together.
Mm-hmm.
So I've seen things like someone coming in for incontinence, and when I work on their inner thigh muscles, the adductors, they're extremely tight. I work on them as close as I can, kind of to the pubic bone without invading any privacy. I get consent, of course. And they'll come back and say, man, together with that with the physio, I'm not having as much incontinence. I'm not having as much leaking. So there's definitely evidence that's showing that having that treatment to the muscles and external tissues are connected to what's happening internally in the pelvic area.
Yeah, that's amazing. When you were talking, what came to mind is people, I have a condition called interstitial cystitis, so I already know that, but for people that don't
Mm-hmm.
know that, I think about all the people that have a hypertonic pelvic floor, that all those muscles are gripping around, right?
That's right. That's
And
right.
they could really benefit from massage therapy to release those muscles, because
Mm-hmm.
sometimes even if you're stretching and stuff, you're not getting deep enough, right?
No,
So
no. And there's so many specific points that you wouldn't even know to go there, much less be able to access those tissues. So this is where, our training comes in. In school, I'll be honest, we don't spend a lot of time on addressing concerns of the pelvic floor unless you're doing a specialized training. So part of my interest was I was so interested in it, and one of my business partners, we have an education business for massage therapists who want to expand their perinatal knowledge. We created a postpartum course. She went off and took training. I went off and took training. We took our experience, our blended experience of multiple years, a couple of decades between us, and we created training for massage therapists to realize they already have the techniques. They
yeah.
already know the anatomy, but in school, they might not have been steered to focus and direct their treatments to address these concerns. And we have such a valuable set of tools that we can use that can help.
That's amazing. And we touched on it a little bit, but for those that they don't know that they have pelvic floor concerns, or they're just
Mm-hmm.
looking for something outside of there, how does massage sort of benefit those other moms that are like, okay, well, I don't have incontinence or diastasis, but like, can massage also be beneficial for me?
Absolutely. So if you are we've been speaking a lot about pregnancy and postpartum, but I mean, to support your pregnancy, all the physical changes that are happening, the stress on your posture, most mamas that I know are pregnant while working or working while pregnant
Yeah.
and are in different positions for their work. So the support that you can get with massage therapy can just often ease the natural discomforts that come along with pregnancy so that you're more functional, happier in your pregnancy. And then all the stress management related things, circulation, nervous system, every single system touch has an impact on your physiology, your anatomy, your neurology, your psychology.
That's
This is all that we are, right? Like, and more.
that's amazing. Like, I would say, like, so many benefits.
Hmm.
So I was going to ask you, do you have any programs currently? I know you do in-person massage, obviously, because I come to see you for that. But are
That's
there other
right.
like online? So you work out of Whitby, right?
That's right. So I work out of the
Sort of things you have going on right now that you can share with the community.
Sure, absolutely. So I work hands-on as a perinatal focused therapist out of the Women's Health Physiotherapy Center location in Whitby, Ontario. So I do a certain amount per week of hands-on treatment, but my focus really has been on education and the programs that I run. So the main program that I'm running right now and just launching is the Flow Birth and Beyond Method, which is designed for pregnant mamas expecting a baby with a special need, an anticipated special need. And this program is to teach pregnant women how to basically empower themselves and take back the pregnancy. Because I know firsthand what it's like. You almost feel like your pregnancy is being ambushed. Here
Yeah.
you were, you're excited, or maybe you're not so excited, but you're just sort of expecting to be like what you knew or what everyone else is going through. And now there are all these unknowns that have been placed in front of you beyond the unknowns that come with every pregnancy.
Hmm.
And if you're proceeding with your pregnancy, you want to be able to be connected to it for yourself so you can prepare for your birth, enjoy the pregnancy, but also so that you can be connected to your baby. Because research does show that when women are experiencing trauma and they're sort of disconnected from their pregnancies, when babies are born, the bond isn't as strong and it's a lot more effort to create the bond.
Hmm.
So my program focuses on all of that, really working with mom, helping to heal the trauma, empower, really acknowledge her where she is and what she's feeling, that it's all normal, but also provide her with tools for empowerment and growth, and then for preparation for the birth, and then the connection with the baby.
Okay,
So
awesome.
that's the Flow Birth and Beyond method.
Okay, that's amazing. I love that. Like, I wish I had known, but there was no way to test for what Gracie has, right? There's
Hmm.
they do like a when they're born they test, right?
That's right.
But I think that people that know in advance, they're going to get a lot of benefit from that program, right? To
Hmm.
work through those feelings because like now you're born, the baby. Like for me, it's a different journey. I wish I had known and been able to access a program like that, like the one you created, right? I think
Right.
that that's amazing. But now I'm benefiting from you.
That's right. We're connected now. We met how we were supposed to meet, right?
Yeah,
So that's a
exactly.
great thing.
Exactly. So I'll pop in like your information for those that want to get in touch with you. And
Absolutely.
after we're done as well, you have a group. So
I
I'll put
do.
the group as well in the comment section. Not too savvy how to do that while I'm on this because I
That's fine. Why don't we just let it go on after, right? Then your people can see it later on. They can
yeah.
request to join. Make sure you answer the questions if you are a mama who's expecting a baby with an exceptionality.
Amazing. Thank you so much for coming and taking the time out to talk to the group. Um, I'm sure that a lot of people maybe didn't realize that how pelvic health and massage tied into one another.
Hmm.
Even myself, I would say that I had a lot of knowledge on pelvic health because it's something I do, but the
That's right.
massage piece was something I learned from you, which is nice. I just knew like breath alignment and these exercises because I am a fitness trainer. So from that aspect,
Aspect, yes.
physio, but now I'm happy that you've introduced me to how massage can also benefit
Hmm.
moms that are going through pelvic health. So I will also, I started now referring clients to see a massage therapist as well. I always used to just refer
Excellent.
to a pelvic health physio, but now I
That's
know
right.
also refer to massage because they can benefit. So thank
Excellent.
you so
Excellent.
much.
Thank you, Alison.
All right, take care. Bye
Bye
bye.
for now.